Nursing care plan for a patient with borderline personality disorder, BPD, is characterized as a pervasive pattern of instability of interpersonal relationships, self-image and effects, and marked impulsivity beginning by early adulthood and present in a variety of contexts. Assessment and diagnostic criteria for patient with BPD. Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Frantic efforts to avoid real or imagined abandonment. A pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. Impulsivity in at least 2 areas that are potentially self-damaging, like spending, sex, substance abuse, reckless driving, binge eating. Identity disturbance, markedly and persistently unstable self-image or sense of self. Identity disturbance, markedly and persistently unstable self-image or sense of self. Affective instability due to marked reactivity of mood, for example, intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. Chronic feelings of emptiness. Inappropriate, intense anger or difficulty controlling anger, like frequent displays of temper, constant anger, recurrent physical fights. Transient, stress-related paranoid ideation or severe dissociative symptoms. Nursing diagnosis to behaviors commonly associated with borderline personality disorder. 1. Risk for self-mutilation. Risk factors are history of self-injurious behavior, history of inability to plan solutions, impulsivity, irresistible urge to damage self, feels threatened with loss of significant relationship to. Risk for self-directed violence. The patient has history of suicide attempts, ideation, plan, and impulsiveness. 3. Complicated grieving. Risk factors are depression, persistent emotional distress, rumination, separation distress, traumatic distress, verbalizes feeling empty, inappropriate expression of anger. 4. Impaired social interaction. The patient may have alternating clinging and distancing behaviors, staff splitting, and manipulation. 5. Disturbed personal identity. The patient may have feelings of depersonalization and derealization. Childhood abuse, fears of abandonment, internalized RAD.
Created using Powtoon.